Hello and welcome to today's training workshop on health literacy. I would like to start off by introducing myself. My name is Megan Farraher and I am the new Director of Performance Improvement here at Brownville Memorial Hospital. The intended outcome of this training series is to improve patient and family ratings on satisfaction surveys. The hospital has identified the following as key areas of concern for staff to work on. By the end of the training series, we hope that staff will better be able to communicate clearly with patients, utilize patient-friendly health education materials, address language and cultural differences, help patients remember how and when to take medications, and encourage patients to ask questions. The two areas of development that we will focus on today are communicating more clearly with patients and addressing language and cultural differences. These two areas are the foundations for establishing better health literacy among patients. Communication between patients and healthcare providers is important because it helps patients understand their health and how to improve it. It helps to create relationships among healthcare workers and patients and enables the patient to feel more comfortable. Open communication also increases dialogue and the opportunity for questions that patients may otherwise be too afraid to ask. The second key area is addressing cultural and linguistic differences among patients. Doctors and nurses must ensure that they are explaining everything in a way that makes the most sense to each individual patient. Some examples of cultural and linguistic competence include availability of translation and interpreter services. It is also important for healthcare providers to be cognizant of cultural norms around privacy, religion, and family that may affect a patient's willingness to disclose information or make lifestyle changes. A working definition of health literacy that we will use for the purpose of this training is a patient's understanding of their health and how to improve it, which gives them the autonomy to make decisions and be more involved in their health care. Everyone has a different degree of health literacy, which is why it is best practice to use plain language and avoid medical jargon. The more a patient understands his or her health, the more autonomous he or she will feel and the more compliant they will be in taking medication. Increased health literacy also fosters support from friends and family and allows them to know how to assist the patient. Two national policies that helped increase health literacy include the founding of the Office of Minority Health and the addition of the National Standards for Culturally and Linguistically Appropriate Services in Health and Healthcare. These two programs focus primarily on those who speak limited English or may not be as educated about their health and treatment options. These policies use interpreter services and cultural competence to better relate to patients and to get their point across. Ubiquitous health literacy can only be achieved when all people, despite any cognitive limitations or socioeconomic status, have equal access to their health care. There are a few methods that can assist with achieving increased health literacy. The teach-back method is important in healthcare settings. It encourages the patient to repeat back what has been told to them. This way, doctors and nurses can ascertain what exactly the patient has retained and how they understand the information provided to them. It also allows the patient time to process what they are hearing and come up with any questions they may have. Using plain language is effective when disclosing information to patients to avoid any confusion. The use of medical jargon can be impersonal and make the patient feel scared and confused. It also prevents patients from asking questions because they do not want to appear uneducated. Interpreters should be offered to all patients based on their preference. Cultural competence trainings should be provided to staff members in medical environments so that they can more fully understand their patients and how to get across information to them. When writing healthcare materials, the language should be comprehensive and easy to understand. Readers should be able to tell at a glance what they are looking at. Resources should include ways in which patients can get more information. Materials should have headings and subheadings and appropriate use of visuals. At this point in the training, we are going to move into our group exercise. This exercise will include an assessment of the hospital's shortcomings and the use of health literacy to improve these shortcomings. Each group will be given 3 scenarios from patient experiences and will work together to figure out how to respond to the patient in the most culturally competent manner. The goal of this exercise is to encourage groups to think more openly about effective communication with patients. It also aims to create more cultural and linguistic competency among staff. Materials have been provided, and groups will be given a 30-question assessment that will provide a starting point for groups to think about where the hospital stands on health literacy and where to go from here. Patient scenarios have been written on index cards and have been provided to you. You will be given 20 minutes to complete this exercise. The expectation is that you will figure out which areas most need to be addressed and come up with target goals. You will use critical thinking to collaborate on solutions to reported problems. We will then have a group discussion about how you have implemented the tools you learned to increase health literacy in your work with patients. Thank you for participating in the training workshop, and I look forward to hearing the group discussions.